Pediatric nurses often work with our teens that are struggling with drug abuse or tobacco abuse. It's important that these nurses understand that they should exhibit non-judgmental behaviors. So for example, the words and the language they use when they're counseling these youths should be non-judgmental, along with their facial expressions. It's also important to understand the factors that lead to illicit drug abuse or signals or indicators of drug abuse. Those characteristics include bad family relationships at home, bad life events that would encourage this type of illicit drug behavior, lower grades, decreased appetite, poor hygiene, at times exhibiting anger, lower interest in activities with their family and friends, and again, some prior family history of drug abuse. When we look at tobacco abuse and teen smoking, we see some of the same characteristics. They involve not only smoking cigarettes, but selling and using illicit drugs, violence, dropout, and low grades, along with teen pregnancy. Now, as a pediatric nurse, you'll be involved in identifying addiction, coming up with support groups and designing support groups that will help these teens recover from their illicit drug use and their tobacco abuse, along with coming up with plans to relieve them and cure them of these poor, unhealthy behaviors. And also just simply counseling on the effects, the health effects of illicit drug abuse, along with nicotine addiction.